There are two reasons why patients go out of network, and it has nothing to do with their income or cash reserves. And I'm here to tell you why. My name is Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes and thrive in business. When we look at cash pay patients, there's only two real reasons why they go out of network, and it doesn't have to do with how much money they have. These people are normal people who just want to feel better and stay active. When they are going out of network, they're looking for two things. Number one, they're looking for the skills. They weren't able to get the skills or the outcomes that they needed inside an insurance-based model. That's why they're going outside. Maybe it was because they didn't have the time. Maybe that clinician was average. They were a new grad, or that person was established. They've been practicing this for so long, but because that person worked in an orthopedic mill, they couldn't apply the skills that they needed. So that's where you benefit from. If you're an out-of-network or a cash-pay physical therapist, understand that that person didn't get the outcome because that person treating them prior didn't have the skills. So the reason they go out of network is to look and find somebody who has those skills, and it's probably you. That's the first thing. The number two thing is the experience. Because there were probably one of four people in that room who couldn't be heard, they didn't get the time to be heard, and they didn't get the actual experience that they wanted because they just wanted to be heard, listened to, so that they understood what the problem was. Now, those two things are the real reasons why patients go out of network. Now, how do you support people along that process? Well, number one, you have to get the skills to make sure that you can deliver on exactly what these patients are looking for. And number two, you have to understand, I mentioned the word experience, not time. People aren't looking for more time because even if you had 2 hours, you might not get or give what that patient needed. You have to truly understand what that patient is looking for. What's the experience that they're looking for? Do they just want to be heard during that time? Do they want to go through running analysis? Do they want to work on form and mechanics and program design? You have to figure out what it is that they want. So some people want to be heard. Some people want more time. Some people want something specific. But because of that, you have to figure out and tailor that experience to that patient. So as a cash-based physical therapist, develop the skills that will get you the outcomes long-term with these patients. Number two, make sure you're providing an incredible experience for these individuals that they weren't getting in work or in a traditional insurance-based model. So what are the two reasons that patients go out of network? Number one, poor outcomes. Number two, poor experience. Solve those two problems for patients, and that will get you a schedule filled with cash pay patients so you can enjoy going to work and working with the people that you love. That's why you opted in for cash-based physical therapy. I hope this improves your clinical practice and ultimately allows you to thrive in business, to enjoy the career you've always enjoyed.